Welcome to the deep dive. Today we're getting into a really significant global health issue, breast cancer. Just to give you some context, in 2020 alone, we saw over 685,000 deaths worldwide. And the projections, they suggest we might hit 3 million new cases every year by 2040. That's staggering. And it really just highlights how much we need better and especially more accessible tools for prevention and diagnosis. So for this deep dive, we're tackling a really fascinating area, kind of an evolving field of research that connects our metabolic health directly to breast cancer risk and how it progresses. We're going to unpack something called the Triglyceride-Glucose Index, or the TI index. And just to mention, this deep dive is based on a review by Dr. Reza Lankarani, who's a general surgeon and researcher from his platform Surgical Pioneering series.
That's right. And the TIG index, it sounds technical, but it's actually a pretty simple calculation. It just uses your fasting triglycerides and your fasting glucose levels. You can think of it as a sort of stand-in, maybe a surrogate marker for insulin resistance and metabolic syndrome.
Okay, insulin resistance, metabolic syndrome. Why are those important when we talk about cancer?
Well, that's key.
Yeah.
Because when your body's insulin resistant or, in that state of metabolic syndrome, it basically creates this environment that's pro-inflammatory and also hyperinsulinemic, meaning lots of insulin. And that kind of environment is almost like fertilizer for tumors. High insulin plus related growth factors, they can actually push pathways that help cancer cells grow and stop them from dying off naturally.
Right, so it really fuels the fire, so to speak. Okay, so our mission then for this deep dive is to explore a systematic review and meta-analysis. This study looks specifically at how the TIG index relates to breast cancer risk, whether it can help tell the difference between malignant cancerous and benign non-cancerous breast lumps, and also its potential to maybe predict how the cancer might progress. It's definitely a complex picture, and as we go, I think you're going to find some really surprising twists. Okay, so let's unpack that first big question. Does having a high TIG index actually mean you have a higher risk of getting breast cancer in the first place? Because the research, as you said, it paints a kind of nuanced picture, almost contradictory depending on the study design.
Exactly. So when you look at case control studies and cross-sectional studies, these are the ones that either compare people who already have cancer to those who don't, or just take a snapshot in time they did find a significant link. Yeah, individuals with a higher TIG index, they had almost double the risk of breast cancer. The odds ratio is about 1.87. And what's really fascinating, as you mentioned, is the dose-response analysis. It wasn't just a straight line, like more TIG equals proportionally more risk. It suggested a non-linear relationship, meaning the risk kind of jumped up disproportionately once the TIG levels got higher.
Wow. Okay, almost double the risk and nonlinear. But then we look at the other type of study, right?
Yeah.
The cohort studies.
All right. And this is where the story shifts. Cohort studies, which many consider, a stronger design because they follow people over time before anyone develops cancer. Well, they did not confirm this relationship. They found no significant link between a rising TIG index and the subsequent risk of developing breast cancer.
Yeah.
The hazard ratio was very close to 1.04 and not statistically significant.
So a real contrast there. How do we square that? Why the difference?
That's the million-dollar question, isn't it? And if we try to connect this to the bigger biological picture, the review suggests something quite important. It suggests that the TIG index might be acting more as a marker of metabolic changes that happen because of cancer progression.
Ah, okay.
Rather than being a direct predictor of getting cancer in the first place. Think about it. Maybe in the early stages of insulin resistance, your body's compensating, keeping glucose pretty stable. But once a tumor is actually present, those cancer cells are metabolic hogs. They ramp up their glucose and lipid uptake. That's the famous Warburg effect.
Right, I've heard of that.
Yeah, they switch fuel sources to grow fast. And that, plus the inflammation that often comes with cancer, messes up insulin signaling even more. And that makes the TIG index go up. So, for you listening, it's a critical distinction to grasp. Is this index predicting the start of cancer, or is it reflecting the metabolic chaos after cancer has taken hold? The evidence leans towards the latter based on these differing study results.
That makes a lot of sense. That distinction is really key. So, okay, the risk prediction picture is murky. But let's move to an area where you said the findings were more consistent, maybe more promising. How good is this TIG index at telling the difference between a malignant cancerous lump and a benign non-cancerous one?
Yeah, here the picture is much clearer. The systematic review showed pretty convincingly that the TIG index can effectively differentiate between malignant and benign breast lesions.
Okay.
The overall measure of its ability to do this, the pooled area under the curve, or AUC, was 0.64. Now, an AUC of 0.5 is basically random chance, like flipping a coin, and 1.0 is perfect prediction. So 0.64 indicates, a reasonably good predictive value.
Better than chance, definitely.
Absolutely.
Yeah.
And what's even more exciting is that one specific study included in the review found an even stronger predictive value. They reported an AUC of 0.835. And at a specific cutoff point for the TIG index, they found it had about 66% sensitivity, meaning it got 66% of the cancers, and over 93% specificity, meaning it correctly identified non-cancerous lesions 93% of the time. That's quite accurate, especially the specificity.
Wow, 93% specificity is impressive.
Yeah.
And this is where it gets really interesting in terms of practical use, isn't it? I mean, think about the potential here. A simple, cost-effective blood test marker that could be hugely valuable, especially in places where maybe advanced imaging like mammograms or MRIs isn't readily available, or there are long waits.
Exactly. That's the real potential power here. It's accessible, and the biological reasoning holds up too. Malignant tumors, because they're growing so fast,
Right.
they just have this ramped up metabolic activity. They're gobbling up glucose through glycolysis, they're making fats through lipogenesis, and the TIG index is basically capturing an echo of that increased metabolic demand, particularly around glucose and lipids. Plus, you have that pro-inflammatory environment associated with cancer, which also tends to push the TIG index higher. Creates a clearer signal in this context.
Okay, so good potential for differentiating lesions. Now, what about prognosis? Can the TIG index tell us anything about how breast cancer might progress or how it might impact survival? This raises, as you said, an important question, but the findings here sound, well, a bit all over the place.
Yeah, that's a good way to put it. The findings on prognosis are inconclusive, sometimes conflicting. It made doing a combined meta-analysis quite difficult for the reviewers. For instance, you have one study by Lagvu and colleagues from 2023. They found a significantly higher risk of death from any all-cause mortality in patients with a higher TIG index, specifically above 4.62.
Okay, so higher TIG, worse survival in that study.
Correct. They calculated about a 64% increased risk. And they also found that for every 1 unit increase in the TIG index, there was about a 19% increased risk of all-cause mortality. So that points towards higher TIG being bad for prognosis.
But there's always a but, it seems.
Yes, there is. Then you have another study, Onder et al., from 2024, which found something quite different. They found that overall survival and progression-free survival were significantly lower, meaning worse outcomes in breast cancer patients who had a TIG index less than 8.43.
Wait, lower, so a lower TIG index was linked to worse survival in that study. That seems completely counterintuitive given everything else about metabolic dysfunction.
It does, doesn't it? It seems to contradict the general idea that higher TIG reflects worse metabolic health, which we usually link to worse cancer outcomes. It's a really crucial inconsistency that the source material highlights directly. We don't have a clear answer from this review why that might be the case in that specific group of patients. It really underscores how complex this is.
Absolutely. That's a fascinating puzzle. What about metastasis, the spread of cancer? Is the TIG index linked there? Is it just as mixed?
Pretty much, yes. The data on TIG as a marker for metastasis is also quite mixed. One study, Karagan et al., 2023, reported that patients with higher TIG values had a significantly shorter time until the cancer spread to the brain, about 15 months compared to 35 months for those with low TIG.
Okay, so higher TIG, faster brain mets in that case.
But then another study, Rajakumar et al., 2023, looked at metastasis in general and found no significant difference in TIG index values between patients whose cancer had spread and those whose hadn't. So again, conflicting results. We can propose biological reasons why TIG might be involved in metastasis. Insulin resistance might help cancer cells become more mobile. Insulin itself can promote blood vessel growth that feeds tumors. High blood sugar can create damaging molecules that prepare sites for metastasis. But the fact that the studies show different things suggests these effects might really depend on the specific cancer subtype, maybe the stage of the cancer, or other individual patient factors. It's not a simple one-size-fits-all marker for metastasis risk based on this evidence.
So putting this all together, what's the main takeaway here? What should you, our listener, really understand about the TIG index in breast cancer from this review? It sounds like, while it might not be a strong predictor of getting breast cancer in the first place based on those big cohort studies,
Right.
it does seem to consistently reflect metabolic changes that are linked to cancer progression. And maybe most clearly, its ability to help distinguish between malignant and benign breast lumps seems like a real standout feature.
That sums it up well. And it's important, as the review authors point out, to acknowledge the limitations here. They did find evidence of significant publication bias, particularly around those initial risk findings, meaning studies showing a strong link might have been more likely to get published, potentially skewing the overall picture a bit.
That's always a concern in meta-analyses.
It is. Plus, there's variation in how the studies were designed, who the patients were, and not all studies adjusted for the same potential confounding factors, like lifestyle, exercise, diet, or socioeconomic status, which can all influence metabolic health and cancer risk. And the lack of really consistent, long-term perspective data makes it hard to definitively say cause and effect.
Which really highlights why more research is needed, doesn't it?
Absolutely. The review makes some good recommendations for the future. Things like doing mediation analyses to see if TIG predicts risk independently, maybe trying to standardize the TIG cutoff points used in studies, definitely conducting more large, long-term longitudinal studies, and importantly, looking at how the TIG index could be integrated with other tools like imaging and molecular tests into a more comprehensive diagnostic approach.
Okay, so let's recap the core takeaway for you listening. The TIG index, it's accessible, it's cost-effective, seems to have real clinical relevance for understanding the metabolic side of breast cancer. Its potential strength seems to be in helping distinguish between benign and malignant breast lesions. That's a really significant finding. While its role in predicting who gets cancer initially is still, let's say, under investigation and maybe less clear, its usefulness for understanding progression and potentially aiding diagnosis seems much more undeniable based on this review.
And maybe a final thought to leave you with. Just consider how deeply connected our metabolic health, things like insulin sensitivity, glucose control, lipid levels, is to our overall risk for complex diseases like cancer. As this research continues, you can sort of imagine a future where a simple, readily available marker like the TIG index could become a routine part of early diagnostic workups, perhaps guiding more personalized health advice, maybe helping to stratify risk, potentially even improving outcomes down the line. It makes you wonder, what else might we learn when we really truly deep dive into these intricate metabolic signals our bodies are sending?
A fascinating thought to end on. And just a reminder, this deep dive was created based on a review by Dr. Reza Lankarani, general surgeon and researcher, which he authored on his platform's Surgical Pioneering series.